Today, on International Childhood Cancer Day, we unite as a global community to raise awareness, inspire action, and advocate for every child's right to life-saving cancer care. Childhood cancer knows no borders, and neither should the fight against it. Across the world, researchers, doctors, advocates, and families are working tirelessly to improve prevention, diagnosis, treatment, and support for children battling cancer. But we must do more. Equity in childhood cancer care is not just a goal, it is a necessity. In this video, experts and advocates from different regions share their voices, their hopes, and their commitment to changing the future of childhood cancer. Because together, we can make a difference.
Hi, my name is Dr. Logan Spector. I am a professor at the University of Minnesota in Minneapolis, Minnesota, USA. I am also the chair of the Childhood Cancer and Leukemia International Consortium, also known as CLIC. Our website is www.clic.ngo, and CLIC pools research studies on the causes of childhood cancer from around the world in order to understand the causes so that we can predict the risk in children, so that we can detect it early, and maybe someday so that we can prevent it entirely. So on this International Childhood Cancer Day, I am very grateful for your attention, and please feel free to write me if you have any questions at all about CLIC, the causes of childhood cancer, or why childhood cancer research is important. Thank you.
On this International Childhood Cancer Day, we unite to raise awareness and call for stronger action. As a medical doctor working on childhood cancer research, I understand the overwhelming burden on families of having a child with cancer. Unfortunately, many still lack access to the care they need. Research reveals that prenatal and postnatal exposures contribute to childhood cancer and its rarer subtypes. To address this, the CLIC Data Coordination Center at IARC was established to facilitating collaborator research within the consortium to enhance the efficiency of large-scale epidemiological studies to identify risk factors and improve prevention strategies. So let's take action together, support research, and fight childhood cancer. Your contribution today will drive the childhood cancer research discoveries of tomorrow, because every child deserves a chance at life.
Every year, thousands of children worldwide are diagnosed with cancer. However, many still face a harsh reality. Access to timely and accurate diagnosis and treatment remains limited.
In Latin America, children and adolescents experience higher incidence and mortality rates compared to other regions.
Every child deserves a chance at life. Research looking for preventive measures. Also invest in research studies and looking for better treatments for vulnerable populations of the world is necessary.
Today, on International Children's Cancer Day,
Let's remember our work can make the difference. Because the fight against childhood cancer knows no limits.
Hello, I'm Svetlana from Latvia. We are a small country in the Baltic Sea. I'm working in a main children's hospital in Riga. As a pharmacist working in pediatric oncology, I participate as a member in the European Society of Oncology Pharmacy Global. I'm a chair of Pediatric Cancer Working Group of ESOP. On International Children Cancer Day, I would like to say that everyone's health is important for us. Whether we work in office, in a warehouse, in a laboratory, or in a consultation with patients, our actions are aimed to everyone who needs our help. This may discourage us at times when the social conditions do not allow to reach everyone, but we does not stop. This day aims to draw attention to the scourge of humanity and to make it clear that we need strength every single day. We need energy to support our patients who are battling cancer. Achieving equal access to essential and novel anti-cancer medicines for all children and adolescents across Europe has been one of the key objectives of the European childhood cancer community. The survey in 2018 had found that lack of appropriate child-friendly medicines was the main issue battling pediatric families in oncology. The absence of appropriately manufactured child-friendly oral formulations, especially in pediatric oncology, is a global emergency which requires urgent solutions. In addition, there are inequalities in access to newly approved medicines for children with cancer. One of our working group recent article main recommendations is to ensure sustained public funding for academia to systematically run clinical trials on child-friendly oral formulations of medicines in cancer. Together, we will continue fighting for our patients' brighter future.
Hello everyone. Today on the International Childhood Cancer Day, we stand united with the children, families and caregivers fighting against childhood cancer across Africa and worldwide. Cancer remains a leading cause of disease-related death in children, yet too many lives are lost due to late diagnosis, limited access to treatment, and gaps in research. As the African Society for Dental and Craniofacial Genetics, we recognize the vital role of genetics in understanding cancer risk, including oral cancer that affect children, which are often overlooked. So early detection and genetic insight can transform oncology and ensuring better diagnosis and targeted treatment. So let this day be a start of a call of action to strengthen healthcare system, support innovation and bridge disparity in childhood cancer.
Hi there, myself Dr. Sunishta from Santosh Deemed to be University. Happens to be India's first private university in medical science, where we take initiative for preventing and curing different forms of diseases, including childhood cancer. Over to my colleague.
Yes, hi, I'm Dr. Dakshina, and we want to talk about prevention of childhood cancer. In spite of its difficulties for its diagnosis and awareness programs and lack of healthcare, we need to work in collaboration with the international partners to ensure that we are able to raise our concerns for giving them healthcare needs and also provide proper diagnosis and ensure that we are able to support their families and take care of them. For this, our university ensures that we do take care of prevention of childhood cancer by creating activities and also raising awareness. And let's take a leap forward to ensure the safety of those affected by childhood cancer.
Thank you.
Thank you.
Hello, my name is Saka Gharib Omar. I'm the lab director in the hospital in sometime visitor assistant lecturer in the Jan University in Erbil. I'm living in the Kurdistan region of Iraq. Today, in the eve of the International Childhood Cancer Day, I want to share a message of hope and commitment. Childhood cancer touch every corner of the globe, and its impact is felt not only by the children fighting the disease, but also by families, communities, and health professionals everywhere. In our lab, classroom, and clinics, we work every day to improve diagnostic and treatment, but awareness is the first step toward mobilizing the support and research needed to bring better care and ultimately a cure. I invite you all to join me in advocating for stronger action and more resources and global solidarity in the fight against childhood cancer. Together we can bring hope to children and families worldwide. Thank you.
Hello everyone, I'm Wadabet Joseph Uzenga from Tanzania, a medical lab student from India in Punjabi Technical University, PCTE. As we are approaching on International Childhood Cancer Day, which will be done on 15th February 2025, according to the WHO database, it has shown that its estimated number of 400,000 children and adolescents aged 0 to 19 years of age are born daily with childhood cancer. The different childhood cancer which affect those children, such as lymphomas, brain tumors, leukemias, sickle cell, all those that tries to affect children. Coming to the WHO database, it has shown that developed countries, more than 80% children born with cancer are provided with sufficient care, but coming to developing countries, 30% daily die with cancers. This is due to late diagnosis, misdiagnosis, poor technologies, and also few research conducted done, meaning that they have got insufficient funds from the government. So we urge you that we call for the government to analyze those policies concerning how they can fund researchers so as they can easily provide knowledge concerning childhood cancer. Thank you, everyone.
Every year, 280,000 children worldwide are diagnosed with cancer.
But did you know that in the low and middle income countries, only 20% survive? This shouldn't be the reality.
Global Initiative for Childhood Cancer, ensuring at least 60% of children survive by 2030. But we need your help.
Kings and Queens Medics is taking action. Here's how. Social media campaigns to spread early detection tips and busting myths, counseling services because no child or family should face this alone, and offering telemedicine services to bring expert care to families even in the remote areas.
Inspiring action starts with you. Share, learn, support. Together we can close the survival gap.
In World Cancer Day, I would like to raise awareness of the importance of patient advocacy and patient advocacy group in navigating cancer patients through the available options and latest information related to their conditions and their treatments. I am Bilqis Al-Dimshawi. I am the Vice President of Cancer Care Egypt Foundation, twice cancer survivor, and an avid patient advocate.
Welcome everybody. This is Dr. Abir Hussein. I've been working in the field of children cancer for more than 20 years. I'm nurses and I've seen a lot of cases really. And I have some messages here for this day. One of the messages is for the big investors and the money heads. Please invest in the field of research in childhood cancer. It's translated into giving higher survival rate and higher cure rate and higher chances for life. It's really blessed to invest in this field. And I have another message for general practitioners and other specialties for early detection of cancer in children. I've seen a lot of cases coming to us very late really, and maybe misinterpreted with other diagnoses, totally away and different from childhood cancer diagnosis. Sometimes, so doctor awareness is very important for early detection of cancer in children.
Hello everyone, my name is Dr. Glory Makupa and I'm a clinical oncologist from the United Republic of Tanzania. Today on International Childhood Cancer Day, we express our support to the children fighting cancer. You are truly our real superheroes and your courage inspires us all. We also recognize the great role of parents and caregivers out there. Your love and strength means everything in this fight. Approximately 280,000 children are diagnosed with cancer around the world each year. But the good news is that early diagnosis and treatments can make a huge difference in saving our children's lives. In high-income countries, the cure rate is significantly high compared to low and middle-income countries. Every child deserves a fighting chance by improving early diagnosis, access to treatment, and support. With this, we can save more lives and close the cancer care gaps in low and middle income countries. On this special day, let's all come together to raise awareness and ensure that every child, no matter where they are, has a fair chance at survival and a healthy future. Thank you.
Hello, everyone. My name is Daniela Palheiro Mendes de Almeida. I am an hematologist and researcher at Fundação Oswaldo Cruz, Rio de Janeiro, Brazil. On this International Childhood Cancer Day, I highlight the urgent need for action in childhood cancer prevention. Research shows that both genetic predisposition and environmental factors contribute to pediatric cancers. exposure to harmful substances, inadequate prenatal care, and lack of early diagnosis disproportionately affect children in low and middle income countries. By strengthening prevention strategies, including maternal health education, environmental protection, and genetic screening, we can reduce the burden of childhood cancer. Examples of practical initiatives are folate supplementation, avoid smoking, and promoting breastfeeding to reduce risks. Every child deserves a future free from preventable risks. Together, we can make childhood cancer prevention a global priority.
Olá, meu nome é doutora Elisandra Junqueira, sou professora na Universidade do Estado da Bahia, em Salvador, Bahia, e represento o Nordeste do Brasil. Nesse Dia Internacional do Câncer Infantil, nos unimos para aumentar a conscientização e defender uma ação global mais forte contra o câncer infantil. Apesar dos avanços no tratamento e nas taxas de sobrevivência, desafios persistem, especialmente em países de baixa e média renda como o Brasil. No Nordeste, a região mais pobre do Brasil, o acesso limitado à saúde e atrasa o diagnóstico e o tratamento, contribuindo para altas taxas de mortalidade infantil por câncer. Salvador, a sede da UNEB, abriga a maior população negra fora da África, e ela enfrenta profundas dificuldades socioeconômicas, com 34,9% da população vivendo em assentamentos informais ou favelas, o que restringe ainda mais o acesso aos cuidados médicos. Nossa pesquisa se concentra na estimativa de tempo entre o diagnóstico e o tratamento, na identificação dos fatores de sobrevivência e mortalidade, além de estudos de exposições pré- e pós-natais, contribuindo para a prevenção da doença, e esses achados visam também orientar políticas públicas para melhorar o acesso ao tratamento e as taxas de sobrevivência. O câncer infantil não é apenas uma questão médica, é uma responsabilidade social. Fortalecer os sistemas de saúde, financiar pesquisas e aumentar a conscientização, podemos melhorar os resultados e salvar vidas.
Hello, my name is Mohammed Zakaria Gad. I'm professor in pharmacy at the German University in Cairo and head of the Institutional Review Board or the Ethical Committee at 57 Children Cancer Hospital in Egypt. In the occasion of the International Childhood Cancer Day, I would like to express my deep support to the lovely children who suffer from cancer, and also support to their families who care for their children until complete recovery. I also give great support to the right that every child has the right for a good recovery and to be treated equally well, whether from low-income country or from high-income country. I would also like to send my deep thanks and gratitude to all the doctors, pharmacists, nurses, and caregivers for the support of the children and giving them hope for the better future. I wish all good health and good recovery, and inshallah, Allah will keep them in very good conditions. Thank you very much.
Salam alaikum. My name is Dr. Crispin Bokovani from Manicaland State University of Applied Sciences in Zimbabwe. It is worrisome to note that every 2 minutes a child is diagnosed with cancer. On this Childhood Cancer Awareness Day, we stand together to shine a light on this global challenge. We must advocate for equitable access to quality care for all children with cancer. This means investing in research to find better cures, training healthcare professionals, and providing families with the support they need. Let's raise awareness in our communities. Let your voice be heard. Thank you.
Hello viewers, my name is Hiram Mugwero. I'm an oncology trained nurse working at Kenyatta University Teaching and Referral Hospital. On this International Childhood Cancer Day, we come together as a global community in our commitment to a future where
Every child diagnosed with cancer has the chance to thrive. As nurses, we witness firsthand the courage of these young warriors and the unwavering love of their families. We see their strength in the face of unimaginable challenges, and it fuels our passion to fight alongside them. Childhood cancer is not just a disease, it is a thief that steals precious moments, childhood dreams, and innocent lives. While advancements in treatment have made remarkable progress, the reality is that many children, especially in low and middle income countries, still lack access to essential care, diagnosis, and life-saving medications. This disparity is unacceptable. Today, I urge you to join us in advocating for stronger action. We need increased investment in research to develop less toxic and more effective treatments. We need improved access to early diagnosis and quality care, regardless of where a child lives. We need to support families through their difficult journeys, providing not just medical treatment, but also emotional, psychosocial, and palliative care. Lastly, let us amplify our voices, demanding that childhood cancer be a global health priority. Let us work together to ensure that every child, no matter their background, has the opportunity to live a healthy and fulfilling life. Let us turn our compassion into action. Thank you.
Hi, my name is George. I'm from South Africa, but I live and work in the UK. The UK has managed to reduce its childhood cancer mortality down to very good levels from what were first present in the 1970s. That's still a challenge for developing countries, and through equitable science and medical practice, I know it can be done, and I have bright hope for the future if we can all work together on that.
Hello, my name is Deborah Ekosai from Uganda. I am a social scientist with an interest in bioethics. Today, on the International Childhood Cancer Day, we celebrate the children living with cancer, as well as their parents, their loved ones, and the communities from which they live. As a social scientist, I appreciate the role of health workers in providing treatment, but I am aware that treatment alone is not enough in the fight against cancer. The children need love, emotional support for their mental well-being. I call upon you to love and support these children. It's their right to life, and to the parents, I know that cancer comes along with emotional pain, it comes along with stigma, and I ask that you don't get tired. It's my call to everyone to ensure that these children have a good well-being. Thank you, God bless you.
An International Childhood Cancer Day is an important reminder of the urgent need to improve the access to quality cancer care for the children globally. So I believe that no child should suffer or lose their life because of the disparities existing in the healthcare systems of our countries. So, this day highlights the importance of early diagnosis, advanced treatment, as well as strong support system for both the patients and their families. Moreover, this day reinforces the importance of further research and global collaboration to ensure the development of innovative and cost-effective solutions for the treatment of childhood cancer. My name is Aisha Fikirini. I am a researcher at World Research and Development Group Limited, based in Dar es Salaam, Tanzania.
Hello, my name is Mohamed Sida. I'm a researcher at the Los Angeles Research Laboratory, hosted by International Institute for Environment and Development, and also as a consultant at the Anthroposophy based in Mali, West Africa. On the International Childhood Cancer Day, I will stand together globally to acknowledge the courage of children battling cancer and reaffirm our commitment to fight these diseases. It is a day for hope for all members and most importantly, action to do. Many of parts of the world, including my region, access to quality of care for childhood cancer remain a significant challenges. Like diagnosis, limited resources, lack of specialization facility creating immense hardship for family. We must do more, and we need strong investment in research, improve diagnosis tools, and increase access to essential medicine and treatment centers. Early detection is crucial, And we need empowered community and healthcare workers with the knowledge and the resources to recognize the sign of symptoms of a childhood cancers. Beyond treatment, we must also focus for providing comprehensive support for children and their family, including psychosocial care, nutritional support, and rehabilitation services. They are essential for ensuring well-being and strong long surviving for young patients. International Childhood Cancer Days is a call to action. Let's work together across borders and disciplines to ensure that every child, regardless for where they live, has the chance to healthy and fulfilling life. Feel free to put an action cancel. Thank you.
Hi, good day everyone. My name is Kosi Blessing and I'm from Nigeria. I'm a breast cancer survivor and an advocate. Today, let us stand together to fight against childhood cancer. Every year, over 300,000 children are diagnosed with cancer, leaving families and our communities in shock. But even in the darkest moment, there's still hope. Advances in treatment and research has improved survival rates, and together we ensure that every child has access to the quality care they need. Let us unite to make a difference. Let us raise awareness, let us support research, let us advocate for policy changes and prioritize childhood cancer treatment. Together, we can create a world where no child has to face the devastating effects of cancer. Thank you.
Hello, I am Chairman Japi Borel, a postdoctoral researcher at OCIAC in Cameroon. On this International Childhood Cancer Day, I would like to express my heartfelt support to these brave children and their family fighting against cancer. Your strength, your resilience and hope inspire all of us. Please know that you are not alone in this journey. Together, we will continue to raise awareness and advocate for better treatment, ensuring that every child have a chance to thrive. Please stay strong and keep shining your light.
My name is Frank Richard. I'm from Tanzania. I'm a molecular biologist and a very strong advocate in genetics and genomics. And on this International Cancer Day, we highlight the urgent need of equity in cancer treatment worldwide, because despite the medical advancement in the world, we still have a large number of children in the low-income regions who die from the cancer that are treatable elsewhere. And we have this genetic research which has given us the better diagnostic tools and aid to the targeted therapies, but without the global access to these innovations, the survival rate of these children remains unfairly low. And we know that science should not be privileged, but rather should be right. And let's work together toward universal access to these genomic medicines, affordable treatments, and strong healthcare systems, because every children everywhere deserves a fighting chance. Thank you.
Hello everyone, my name is Odilia Daze, a principal nursing officer from Ghana. Approximately 1,200 children under the age of 15 are estimated to develop cancer annually. Lymphomas, leukemias, and retinoblastomas are some of the recorded cases. Unfortunately, Ghana faces significant challenges in addressing childhood cancers, including limited access to care and treatment. As we celebrate International Childhood Cancer Day, I call on policymakers to rally behind the fight against childhood cancers. Together, we can make a difference. Thank you very much.
Hi everyone, I'm also Milan from Tanzania. I would like to share my views as we honor the International Childhood Cancer Day. The current statistics shows for about 400,000 children under the age of 18 diagnosed globally. However, the mortality rate is so high in less resources setting, for more than 60%. As a researcher and policy advocate for genetic and genomic research, I'm very concerned with the survival inequalities. My general remark is, we should link cancer control with broader initiatives such as Global Non-Communicable Disease Agenda and Sustainable Development. My specific remarks are, we should do technical assessment to improve diagnosis and find a locally adapted solution. Number 2, we should emphasize on ethical imperative for fair chance to help to life care and research. Looking forward to progressing on pediatric oncology. Thank you.
Hi, I'm Sarah Musallam, a pharmacist and medical writer from Egypt. On International Childhood Cancer Day, we come together to raise awareness and support children and families affected by cancer worldwide. Every 3 minutes, a child is diagnosed with cancer. While medical advancements have improved several rates in some regions, many children still face challenges in accessing timely diagnosis and quality treatment. Ensuring that every child, regardless of where they live, has the opportunity to receive the care they need is a shared responsibility. By strengthening global collaboration and investing in research, besides improving healthcare access, we can make a meaningful difference in the lives of children with cancer. Today, let us reaffirm our commitment to creating a future where no child is left behind in the fight against cancer. Together, we can inspire hope and drive change.
Hello, my name is Habiba. I am a medical student. Today is the International Childhood Cancer Day. In this day, we learn more about childhood cancer and know how to support these children. Cancer is not only a disease, it's a fight that no child has to face it alone. We should all raise our voices to ensure that each child lives a safe life free of cancer and has all the access of support and caring. Together we can make a difference.
Story time. Once upon a time, a curse was demystified by a researcher like you. To the researcher researching on childhood cancer, keep working at it. Your insights are the rays of the morning sunrise for the healing dawn we await. To the policymaker, listen to the specialists, for the shouts of recommendations are like the horn of an approaching train. Ignore them at your own peril. To the nurses taking care of the amazing champions battling childhood cancer, your touch is that dew keeping our petals of hope so soft. To the lung specialist doing critical diagnostics, your discoveries are like the ringing bell taking us to the next phase of the treatment. To the doctors who have become our captains in the battlefields against childhood cancer, your amazing knowledge and wisdom is the scent of the beautiful flowers of victory. To all the people out there, get the children screened, diagnosed early, treated early. Anayejua mapema ni shujaa mapema.
Hi everyone, my name is David Makoko from Dar es Salaam, Tanzania. Today on the International Childhood Cancer Day, I stand with every child, every family, and every caregiver facing this battle. Every child's life is precious, yet many children lose their fight. Not because childhood cancer is unbeatable, but access to timely diagnosis and quality treatment is out of reach. No parent should ever have to watch their children suffer due to preventable barriers. We have the power to change this by strengthening our health system, investing in life-saving care, and ensuring no child is left behind. We can turn the tide against childhood cancer. And this is not just a medical issue, it's a matter of equity, justice, and humanity. I urge everyone to act now because every child deserves a future filled with hope, health, and life. Thank
Good
you.
morning. I am Johar Gaad, a researcher at National Research Center for Biotechnology, Algeria. And today on International Childhood Cancer Day, we stand together for the thousands of children fighting cancer. Every child deserves hope, care, and access to life-saving treatment. Our collective efforts in area detection, innovative treatment, and supportive care can change life. So together we can make a difference. Let's raise awareness, support families, and work towards a future where childhood cancer is no longer a threat, because every child deserves a chance to grow, dream, and thrive. Thank you.
I'm Richard Tamo from Tanzania, a researcher in molecular biology, but also a public health enthusiast. As we commemorate the International Childhood Cancer Day, I would like to raise a little bit awareness on childhood cancer. It affects over 400,000 children globally, and 9 out of 10 of these children are in low and medium income countries. My short call today is to all global health partners and national health system and non-governmental organizations to increase collaborative efforts in cancer care and treatment to children. Together, we can increase hope and help children living with cancer. Thank you.
Hi everyone, I'm Ali Banda from Tanzania, a health laboratory scientist. Concerning the International Childhood Cancer Day here in Tanzania, our government is working very, very hard to make sure that it's provide free cancer care to all citizens. Apart from Ocean Road Cancer Institute, our government, in collaboration with Tumaini la Maisha organization, is running a modern pediatric oncology ward at Muhimbili National Hospital. And due to that, I'm inspired, and also I invite all others to fully participate in this International Childhood Cancer Day, so that we can understand and we can know what we have to do to save our children's lives. Thank you very
much. My
much.
name is Hamina Mapunda, a master's student at the University of Dar es Salaam from Tanzania. In each year, an estimation of 400,000 children and adolescents ranging from 0 to 19 years develop cancer, and in this, about 100,000 children die from cancer, leukemia being the most common type of cancer. The survival rate in these children is very low, and it ranges from 0 to 30%. The actual number might be quite big because children cancer is difficult to diagnose. As we celebrate the Children Cancer Day, I'm calling for strong advocacy, responsible funding, and global partnership. Also, good health, physical activities, and protection from the sun can help the children prevent themselves from cancer. And access to specialized care will help raise the survival rate in these children. Let's ensure no child is left behind.
Hello, my name is Katia Mujuvu. I am a biomedical scientist in the field of medical genetics of Mozambique. On International Childhood Cancer Day, I would like to send a message of strength and hope to all the children fighting cancer. You are not alone. Many believe in your recovery. So keep fighting, keep shining. This day reminds us of the importance of early diagnostic and treatment. Childhood cancer is treatable, and timely care saves life. So let's raise awareness, support families, and advocate for better health care, because together we can give a child a healthy future. Thank you.
Hello everyone, I am Sadabi Suleiman Quraish. I am from Sierra Leone, West Africa. I want to be part of the Childhood Cancer Day because I also want my country, Sierra Leone, to benefit. Long since Sierra Leone has been suffering, also the pediatric cancer patients have been suffering because we don't have a large number of trained and qualified pediatric nurses and doctors. Also, we did not have enough equipment, medicine to treat pediatric patients.
Hello, my name is Dr. Hortensia Nondoli, a lecturer from the College of Health and Allied Sciences, University of Dar es Salaam, Tanzania. Previously, childhood cancer was not known to the public because of lack of awareness, and because of that, therefore, its prevalence was unknown. But with further advocacy and awareness, most families are ready to share their journey to the public, increasing the awareness. It is our priority to honor children and families affected by cancer, but also to encourage government and policymakers to support more research and treatment towards children cancer. Let us wear gold ribbon to show support to our children with cancer. One may ask, why gold? It is because it is a precious metal reflecting the value of our children. Together we can make the difference. We love our children. Thank you.
Hello everyone, my name is Opoluwashedipe and I'm currently a research assistant at Nigerian Institute of Medical Research in Africa. As I stand here today, I am reminded of the countless young lives touched by childhood cancer, the smiles, laughter, and dreams put on hold by a disease that seems to have no mercy. But even in adversity, there is hope. Hope from children's resilient families' strength and healthcare workers' dedication. Today, on International Childhood Cancer Day, I call on all of us to join forces in this fight. Let's support families, caregivers, and healthcare workers. Let's invest in research, diagnosis, and treatment. Let's break down barriers between children and the care they need. Let's remember the children who have fought bravely, inspired us with their courage, and will continue to fight until we find a cure. Together, we can make a difference. Together, we can create a world where every children can live, laugh, and dream without the shadow of childhood cancer.
Good day, everyone. My name is Kogetso Morapedi from Botswana. I'm a lecturer at the Institute of Health Sciences in Gaborone. And my message for the ICCD, International Children's Cancer Day, would be that I offer my full support to their fight against cancer. I hope that all the treatments and remedies that the medical facilities provide to them provide the much needed healing. I also hope that in the near future we'll have breakthrough research in cancer that would ultimately see humanity winning against the fighting of this cancer scourge that also ultimately affects the young ones. Thank you.
Hello everyone. My name is Huda Shehi. I am PhD in Telecom, Senior Researcher at UNIFCAM Lab of Subcom Tunisia. In the occasion of International Childhood Cancer Day, I want and I wish the quick recovery of the children who suffer from cancer. And from my position, I want to, and I call all medical staff to give them the necessary supports that they need. Thank you so much.
We deeply thank each expert who shared their voice in this initiative and everyone working to transform childhood cancer care across the world. But this is more than just words. It's born from the pain of children and families facing childhood cancer every day. We are raising these voices to ignite real action, stronger policies, increased research, and greater equity in early diagnosis and treatment. The voices have spoken. The facts are clear, and now we wait for action. Policymakers cannot witness this suffering and remain still. Our children around the world deserve more than awareness. They deserve immediate and decisive action. Silence is not an option. Inaction is not an option. The time to act is now, because every moment we wait, another child fights for their life. Will you let them fight alone, or will you stand with them?